Welcome to Have More Babies. We're here to help you navigate parenting with, well, a bit more clarity.
It's great to be here.
So every parent knows that feeling, right? The sudden crying, the ear tugging. You just know something's up, but what?
That helplessness, yeah, it's tough.
Today, we're tackling one of the biggest culprits behind that feeling, childhood earaches.
A really common one.
Exactly. Our mission is to dive into our sources, especially looking closely at otitis media, the common culprit behind childhood earaches from Omega Pediatrics.
A great resource.
We want to really unpack what otitis media is, what causes it, how do doctors figure it out,
And what can be done about it, critically.
right? Treatment, and maybe even more importantly, prevention. We want to give you clear, actionable stuff.
Things you can actually use.
Okay, let's get into it.
So yeah, earaches, super common in kids and pretty distressing for everyone.
Definitely. You hear earache and maybe think it's just a small thing.
Right, that it'll just pass. But the Omega Pediatrics article points out it can be more specific. Often it's actually otitis media.
Otitis media. Okay, so what is that exactly?
What's fascinating here is the definition. It's an infection or inflammation of the middle ear.
The middle ear. That's the bit behind the eardrum.
Precisely. That air-filled space right behind it.
That distinction behind the eardrum feels important. It's not just general ear pain.
Exactly. It pinpoints the location.
But why kids? Why do they seem to get this so much more than adults? Is it like their anatomy?
Yeah, absolutely. Omega Pediatrics highlights a couple of key reasons. First, it's their eustachian tubes.
Those tubes connecting the ear to the throat.
That's them. In kids, they're different. They're narrower, shorter, and more horizontal.
Horizontal. How does that make a difference?
Well, that setup makes it easier for them to get blocked up. Fluid can get trapped more easily.
Okay. Makes sense.
And the second reason, their immune systems are still, getting up to speed.
Still developed.
Right. So they're just more vulnerable to infections taking hold in the first place. You put those two things together.
The tubes and the immune system.
And yeah, it's kind of a perfect storm for these middle ear infections in little ones.
I can really picture that now. It's not just bad luck. There's a real biological reason.
Definitely.
So, given that predisposition, what actually triggers the infection? It sounds like it's not always just one thing.
You're right. It's often a mix, which is important for parents to get. Omega Pediatrics breaks it down. First up, really common, viral infections.
Like the common cold or the flu.
Exactly. Those things are miserable enough, but they can also set the stage for an ear infection.
How does that work? How does a cold lead to an ear infection? Is it the virus itself getting in the ear?
That's a great question. Not usually the virus directly in the middle ear. It's more about the inflammation.
Okay.
So a cold causes swelling in the nose and throat, right? That swelling can block those eustachian tubes we talked about.
The ones that are already prone to blockage in kids?
Precisely. And when they're blocked, fluid can't drain from the middle ear. It just sits there.
Trapped fluid. Sounds like a bad situation.
It is. It creates this warm, moist place, basically perfect for bacteria to grow.
So the virus starts it, but then bacteria move in.
Often, yes. That leads to the secondary bacterial infections. The article mentions Streptococcus pneumonia, for example. That's a common bacterial culprit.
So the really painful ones might actually be bacterial, even if a cold started at all.
Frequently, yes. That's a key distinction.
Okay, that clarifies a lot. What about other causes, beyond viruses and bacteria?
Well, allergies can play a role too, sometimes overlooked.
How so?
Similar mechanism, really. Allergy flare-ups cause inflammation and congestion.
Which can block the eustachian tubes again.
You got it, leading to that same stagnant fluid situation. And then there are environmental factors.
Like what?
The article specifically mentions exposure to smoke.
Secondhand smoke.
Yeah. We know it's bad for lungs, but it can also irritate and inflame those tubes, making kids much more susceptible to ear infections.
Wow. Okay, that's a big one. Anything else?
Even things like sudden altitude changes are mentioned. Less common day to day, but it shows how pressure affects ear function.
So it really is a range of things. Infections, allergies, smoke, even air pressure.
It's complex.
Which brings us to symptoms. Ear pain is the obvious one, the classic sign.
The most recognized, definitely.
But what else should parents look for? Especially in babies or toddlers who can't just say, my ear hurts.
You're right, that's the challenge. How do you know it's more than just general fussiness?
Exactly.
Well, the source lists several key things. Fever is very common.
A sign the body's fighting something.
Yes. So a temperature spike alongside that fussiness. That's a big clue.
What about hearing? Does it affect their hearing?
It often does. Hearing loss, usually temporary, because of that fluid buildup behind the eardrum.
How might that show up? Like they don't respond?
Yeah, maybe they don't turn when you call them or seem like they're ignoring you or need the TV louder. It can be subtle.
Okay. And you mentioned fussiness.
Irritability, yeah. For little ones, that's often the main sign. More crying than usual, trouble sleeping, maybe not eating well.
They might pull at their ears too.
Sometimes, yes, that tugging motion is a classic indicator, but general, unexplained irritability is really key.
Got it. Anything else? Any visible signs?
Sometimes, yes. You might see fluid drainage coming from the ear canal.
Okay, actual fluid leaking out.
Yes. If you see that, it often means the eardrum has actually ruptured from the pressure buildup. It definitely needs medical attention right away.
Good to know. So if a parent sees these signs, fever, irritability, maybe trouble hearing, or drainage time, to call the doctor.
It definitely warrants getting it checked out.
So how do doctors diagnose it accurately? You can't just rely on symptoms alone, right? What tools do they use?
No, they have specific methods. The process is quite precise. The article mentions 3 main ones. First is otoscopy.
That's the thing with the light they look in the ear with.
Exactly, the otoscope. It lets the doctor get a direct look at the eardrum and the ear canal.
What are they looking for? Just redness?
Redness, yes, but also bulging of the eardrum, or maybe they can see fluid behind it. Direct signs of inflammation and infection.
Okay. What else?
Second is tympanometry. This one's a bit different. It checks how the eardrum moves.
No, it moves.
Yeah, it uses small changes in air pressure. If the eardrum isn't moving properly, it suggests there's fluid or pressure issues in the middle ear space.
Ah, another way to detect that fluid buildup.
Right. It's a good functional test. And third, if hearing loss is a concern, especially if it seems persistent.
Like the child isn't responding well over time.
Exactly. Then they might do audiometry, which is a formal hearing test.
So otoscopy for looking, tympanometry for movement, audiometry for hearing.
That's a good summary. Together, they give a pretty accurate picture.
It's good to know it's that thorough. So once it's diagnosed, what about relief? How is otitis media treated?
The treatment really hinges on the cause and how severe it is. That's why the diagnosis is key.
Right.
Omega Pediatrics lists a few approaches. If it's clearly a bacterial infection,
Like maybe after that initial viral illness.
yes. Or if the symptoms are severe, then antibiotics are often the way to go.
But only for bacterial, right?
Absolutely critical point. Antibiotics do nothing for viruses.
So figuring out if it's viral or bacterial is huge for treatment.
It really is. And avoiding unnecessary antibiotics is important for everyone, thinking about resistance issues.
True. What else besides antibiotics?
Well, for all cases, pain management is crucial. Making the child comfortable.
Using things like acetaminophen or ibuprofen.
Exactly. Over-the-counter pain relievers can really help with the pain and the fever.
It seems like a priority regardless of the cause.
Definitely. And then sometimes, especially for milder cases or ones known to be viral, the approach is simply observation.
Just watching and waiting?
Pretty much. Close monitoring, managing the pain, but letting the child's own immune system handle the infection.
That's probably reassuring for parents, knowing it doesn't always mean immediate medication.
It is. The body often can clear these on its own.
But what if it keeps happening? Or if it's really severe or chronic?
Right. For those recurrent cases, or when fluid sticks around causing hearing problems, surgery might be discussed.
Surgery. What kind?
The article mentions inserting tympanostomy tubes, commonly called ear tubes.
Ah, I've heard of those. Tiny tubes in the eardrum.
Exactly. Tiny tubes placed through the eardrum to help drain that trapped fluid and equalize the pressure.
And that helps prevent more infections.
It often dramatically reduces the frequency, yes. And it helps restore hearing quickly. It's very effective for kids who really struggle with recurrent infections.
Wow, quite a range of options then. From waiting to pain relief to antibiotics to surgery.
It's tailored to the situation.
Okay, let's shift gears. We've covered diagnosis and treatment. What about preventing it in the first place? What can parents do proactively?
Yeah, prevention is so empowering, isn't it? Moving from reacting to proactively protecting.
Totally.
The Omega Pediatrics source gives some key strategies. One big one is timely vaccinations.
It's like regular childhood shots.
Specifically, the pneumococcal vaccine, PCV13, for example. It targets some of the main bacteria that cause these ear infections.
So getting those shots can actually reduce the risk of earaches.
Significantly, yes.
Yeah.
For the bacterial kind, definitely.
That's great info. What else?
Another major one we touched on, avoiding smoke exposure.
Keeping kids away from cigarette smoke, vape smoke, All of it.
All of it. Since smoke irritates those eustachian tubes, keeping the air clean around kids is vital for ear health.
Makes sense. Any other preventative tips?
Yes, treating allergies effectively. If your child has known allergies.
Get them managed properly.
Right. Because, as we said, allergies can lead to that eustachian tube dysfunction. So good allergy control helps prevent that pathway to infection.
Vaccinate, avoid smoke, manage allergies. Seems like a solid plan.
It's a really good multi-pronged approach.
This has been so helpful. We've gone from defining otitis media to causes, symptoms, diagnosis, treatments, and now prevention. So what's the big takeaway here?
I think the main thing is, while otitis media is common, maybe even feels routine sometimes, understanding it really matters.
Knowing what's actually going on.
Exactly. Even things that seem like minor fussiness can signal something that needs informed attention. Trust your gut as a parent.
Yeah.
Observe your child, and don't hesitate to seek clarity from a professional if you're concerned. Being proactive and informed makes a huge difference.
Absolutely. And if you listeners want more details on this or other kids' health topics, definitely check out omegapediatrics.com.
Yes, it's a really great resource. Lots of comprehensive info there for parents.
They offer expert advice and insights that could be so valuable. Again, that's omegapediatrics.com.
And remember, having access to trusted information and professionals is just invaluable for your child's health. Explore the resources there.
You can learn more or even book an appointment if you have concerns about ear issues or anything else. No obligations, just good info.
Well worth checking out.
So if you found this conversation useful today, please do give this video a like.
It helps others find it.
And subscribe to our channel for more deep dives like this one. Maybe share it with another parent who could use the info.
Please do.
It really helps us keep bringing this content to you. Thank you so much for joining us on Have More Babies.
Until next time, stay curious and keep learning.
Goodbye.